Okay. He's got something over there. Well, let's start with some questions over here. Please feel free, preferably if you've got something to say, keep it short, but if you've got questions, please ask. Yes, ma'am.
Sue Fox from Tasmania.
Yes, sir.
Our original Australians looked after their land, and so the land looked after them. And one of the things that particularly they looked after was their health. And in talking about health, it seems to me that one of the words that doesn't get used very often, I'm going to unapologetically use it now, is breast milk or breastfeeding. And we know that our Indigenous health is suffering because babies just aren't being breastfed. And I'd like to put it on as one of the things that should be at the top of our agenda because, as has been said this morning, we need to start right from the beginning. And the beginning is pregnancy, how well that goes, and then how the baby's fed. Thank you.
Sam, you got the mic anyway, whether you liked it or not.
Okay, a lot to say about that. I think breast milk feeding, I'm talking outside of skin health, and which is what we do at one disease at a time. However, turning my mind to MSF and the rest of the WHO, and recently, this is our field have taught me about this, but malnutrition is a significant issue amongst Indigenous people, specifically at an age bracket where it really has an effect on the long-term kind of growth and development of a child. And our issues are, there was a disruptive innovation around the world that actually, in Africa, it was actually in Africa it was sorted out. It was very difficult to get milk to the corners of Africa for a bunch of reasons. One was that it's hard to get refrigeration out to the corners of Africa, and the second was if you're going to have a powder, it was difficult to get clean water to actually mix it with the powder to actually make something that was sustaining for the child. And what they developed only fairly recently was a product called plumpy nut. And I didn't think I was going to be using that word today, plumpy nut. But plumpy nut was a disruptive innovation in every sense of the word in medical public health work. And it was essentially a peanut butter-like sustenance, and it tasted really good. So it got rid of that logistics issue of getting refrigeration out to corners of Africa, and also it was disruptive because it was clean. It was didn't need clean water, but the third thing is it was actually enjoyed by young babies. So I'd just like to probably draw the point that since that disruptive innovation happened, it was the Health of 60 Minutes actually in the US that actually drew attention to it and changed the entire world's perspective on how to treat malnourishment around the world. In Australia, strangely, we don't quite have the same standards. I think it's because we believe that we're not a developing world country. However, we're dealing with the same malnutrition and the same rates in regional and remote areas. However, we haven't adopted this disruptive innovation that we know that works in the rest of the world. So I might just make that point. And thank you so much.
The question, why a supplement? Why not just go back to the breast?
Sure. I think I'm probably excited about it. There are, and I'm speaking from things that I've heard on the ground in remote Aboriginal communities. It is it's an implementation thing, I feel, and again it probably comes back to understanding how to work in Aboriginal communities. It is installing public health and how to get education is part of it. But one thing that I find really fascinating is that I was talking to someone who said, Aboriginal mothers, we need to fix this stuff for Aboriginal mothers these issues around breastfeeding and so forth is a real issue for malnutrition. And I can just speak from rates and numbers that we have done in East Island Land. Aboriginal mothers are the most doting of any mothers in this country, and they care and love their kids. Just I have no idea where this concept comes from, but Aboriginal mothers are the people who come to the clinics the most. And when we talk about skin health, it is that is not the issue that we're having. It's not mothers neglecting children or anything like that. There are other issues. I can't actually probably spell out what they are because it's above my pay grade and outside of one of these at the time. But I'll just probably maybe throw those few points into the mix.
Okay, we'll move on.
5 billion a year. Royalties from mining contribute another 5 billion. Divide 10 billion by 500,000 gives 20,000 per person, man, woman and child. My politically incorrect question is, where does this money go?
Go, Michelle.
It doesn't go to me, that's for sure.
There is questions and myths, I suppose, around Indigenous funding and communities' needs. In some places, in the top end, in the Territory and across to Western Australia, housing is so limited, and it is that crying out for even a road. I drove from Alice Springs to a community called Santa Teresa. It's about an hour and a half out of Santa Teresa, where they're paying $4.50 for a litre of milk. They're paying over $5 in some cases for a loaf of bread. So if somebody's getting a small pension, for them to drive into Alice Springs to do their weekly shop, by the time that if they don't have a car, it's $60 each way in a taxi. There isn't a lot left over. I don't know where the funding goes. The AILC, as I said, received its first lot of multi-year funding for the first time, and our original funding came from the USA under United Way and Citibank. And for us, it's always been a struggle of funding when we know that we make a difference in people's lives. We go into DEWA, which is the Department of Education, because we're an education institution. Do we get funding from them? No. They will do business development funding for us, but they won't give us anything else. We do receive money from Rio Tinto and the Telstra Foundation to run an alumni project, and we've also I personally get executive coaching from Westpac. They all have a real genuine interest in Indigenous affairs. The Reconciliation Action Plans that I'm sure some of you have heard about, they are making a difference to workplaces. How do you retain your best asset, which is your Aboriginal and Torres Strait Islander employee, is a question mark for these guys. How do you retain and recruit them? The reason that we have mentoring programs is that we want to have connection and to find out where the money's going. We don't know. I don't know. That's it.
Certainly Charlie Perkins used to say when he ran the department, it was $1 billion, they're not farms, you say. He said, there aren't many black fellas who live in the Gold Coast from the south of France. It clearly goes to white consultants and others to be non-political. Michael mentioned earlier that a house can cost $800,000 at the Tiwi Island, and it's just a shell of a house. And yet we don't train anyone up there to be mechanics or to be painters or plasterers. We fly white fellas in and fix it, come out and leave it there for them. So the waste is abysmal, but there aren't any black fellas living off the fat of the land. George. Over here, thank you, sir.
Thank you very much.
Oh, ma'am, sorry, excuse me.
That's all right. 33 years ago, I gave birth to a daughter with a disability, and that is the reason that I was recognised with my medal, and for that I am very proud. My daughter is one of the 18% of Australians who has a disability. I am one of the, I suppose, more than 18% of carers in Australia. The jobs are never easy in this role, and it's been wonderful to see that at least the National Disability Insurance Scheme is about, we hope, to be ratified. I would like to see the association endorse in some form the legislation that is before the Parliament and recognise that this sector of our Australian community has long been overlooked. I understand that out of the 28 OECD countries, Australia ranks number 28 in the way it caters and helps and supports people with disability and the carers in our society, which I think is shameful. I would like to comment, though, that I have found this forum very exciting and inspiring, and for someone who is about ready to give up and just survive day to day with my daughter, it's given me the thought that I should really try and keep the battle going.
My daughter goes to school here in, she's in year 12. Last year, 3 of her fellow school girls had committed suicide. We need to do something about youth suicide in this country. It is appalling. One thing I look in this room, and if this was a gathering of Indigenous people, and I would say elders, young people need to be in this space. And we had a conference at the end of last year, and just getting some school kids in to help people get a cup of tea, or help them with some lunch and assist them in different ways. So next time around, come back and have a look. I'd like to see some young people in the room hearing from you and your stories.
Thank you.
Dr. Sam Prince, medical entrepreneur and philanthropist. We should add philosopher and Prince in his own right, after his freedom versus fairness insight. He alluded to our sense of insecurity in requiring a great and powerful friend and the lingering cultural cringe. Sam fingered the burgeoning regulatory burden which is inadvertently giving succour to mediocrity. His frozen monkey anecdote demonstrating the powerful insidious effect of that problem. The local example of banning learn-to-swim classes from Canberra schools is a perfect example of this silliness. Ayn Rand's The Fountainhead and Atlas Shrugged are usually referred to in derogatory tones these days, but I, for one, identify with the wisdom Sam was distilling from those sources. Rochelle Towett, a fine example of why education is an essential key to Indigenous success in the future, a leader and role model in her own right. We lifted the marriage bar so women could continue to be employed in the Commonwealth public service as recently as 1966. And soon after, Australia voted overwhelmingly to give our Atsi people the vote. I won't go into which states and territories were opposed to that measure or why at the time, but it's a truism that the Australian people saw through the politics that were being presented and voted sensibly for that outcome. I will confess to being at the epicentre of Mabo in 1993 and the discussions with Aboriginal leaders from all around Australia at that time. People like Noel Pearson, the Dodson brothers, Michael Mansell, Peter Yu, Loicha O'Donoghue are just some of the names who represent the sort of role models, leadership and mentors Rochelle was referring to. Rochelle rightly focused on leadership. Arguably, there are more definitions of leadership than there are real leaders. I believe that leadership is shaping and sharing a vision that gives meaning to the work of others.